On the same day, President Barack Obama announced sweeping measures to help combat the Ebola outbreak in West Africa.
The world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this.
Some medical experts are criticizing the slow global response. It's now September, about 7 months after the Ebola outbreak started spreading in West Africa. One health expert told the International Business Times, "We wouldn't even be talking about an epidemic today if the president's plan would have been rolled out in March." And another, "Clearly it's too little too late, but ultimately we will contain it. It's a matter of how many lives are lost in the mix." Dr. Kent Brantly, one of the American aid workers for Liberia who survived Ebola after receiving an experimental treatment, met with President Obama Tuesday and said he's now healthy and completely Ebola-free. But that's mainly because he got his treatment in July, well before there was a serious push to ship any of those experimental serums abroad. Brantly expressed that when he spoke before a congressional panel Tuesday.
This unprecedented outbreak received very little notice from the international community until those events of mid-July when Nancy Wright-Bowl and I became infected. The response to date, however, has remained sluggish.
Brantly also told the panel,
"The disease was spiraling out of control, and it was clear that we were not equipped to fight it effectively on our own. We began to call for more international assistance, but our pleas appeared to fall on deaf ears."
Though it's worth noting, Brantly later praised Obama's new plan and even offered up a more unorthodox approach to make it more effective. It includes supplying individuals with personal protective equipment, disinfectant, and hand sanitizers so they can more safely care for patients at home. Another American doctor wasn't as kind when Public Radio International asked her why she thought the response from the international community had been so slow.
I think it's racism. I think it's easy for the world, the powerful of the world, who are largely non-African, non-people of color, to ignore the suffering of poor black people.
On Tuesday, Obama went on to spell out his 4-tier plan to fight the epidemic, including 3,000 additional U.S. troops to West Africa and $750 million in relief. For Newsy, I'm Jay Struberg.